Yes, we are live.
All right, good evening, everyone. It's 6 o'clock, Thursday, February 11th. It's time for our HSA Southwest Chicago Husky Family Podcast. Thanks for joining us on this cold Thursday evening, but we're on the inside, and we're here with Miss Tosin Adeyemi from Sisters Working It Out. I love that title. You know I had to have you on with that title. So don't forget, everyone, to follow us on Facebook, Instagram, YouTube, and Twitter. We are streaming on YouTube Live, so we need you to hit that like button. We need you to share the video with your friends and family. And you can also ask questions of Miss Tosin live through the YouTube chat. So make sure that you listen well and type in some questions. Keep the show live. So, Miss Adeyemi, how are you this evening?
I'm doing great. Thank you so much for having me.
Oh, you got your pink on. You ready?
I have our Sisters Stocking the Spread sweatshirt. I can stand up so you can see it.
Oh, awesome!
The name was come up by one of our members of our team, Dr. Michaela Johnson, and the sweatshirt was designed by Miss Lisa Washington. Very talented.
Hey, do you have a few of those t-shirts?
We have a few more, so we could definitely hook you up with one.
Tell you what, all you listeners out there, if you want a t-shirt, put your name, your email into the chat. We'll do a raffle, and then we will send you a free t-shirt. So my team over at Horizon Southwest will buy those t-shirts to contribute to your organization, and we'll raffle them off to our listeners. That's great.
Wow, thank you so much.
All right, so let's get down to business. So listen, tell me about Sisters Working It Out. Like, where did this organization come from? What's its main focus? It sounds so exciting. You got a lot of things going on. So I'll let you take it, just jump off from there.
Yes, absolutely. I'd love to. So Sisters Working It Out, or SWIO, it was founded in 2001, and it is a cancer awareness and health advocacy organization in Chicago. And our mission is to address disparities in health and access to healthcare for women of color diagnosed with breast cancer living in the Chicagoland area. So we do this in a variety of ways. We provide education on breast cancer and the importance of screening, specifically mammograms. We also do a lot of patient navigation, so from screening and prevention all the way through treatment and survivorship. So we have patient navigators who help women throughout their treatment journey. And we also have a survivor support group so women can get social support and be able to talk with one another. And then lastly, we also host a community workers training. So members of the community who want to pay it forward and learn about breast cancer and also be an advocate for other women can take this training with us, learn about different women's issues, and then be a part of our team. So overall, it's such a sisterhood, it's such a warm community, and we really have stepped up to serve our community during the pandemic. So I'm really looking forward to talking about that later.
Wow, that's really wonderful because, we do a lot. We work in the community, we're taking care of families, sometimes single-handedly, most times single-handedly, and, we're working maybe 1, 2, 3 jobs. So self-care is like really low on our priority list. And I'm so glad that you have an organization that focuses on, two of the biggest health issues that really plague Black women. And I hear you say breast cancer, but don't you do something around cervical cancer, which people don't really talk about a lot?
Yes, absolutely. So just going back on what you said about breast cancer and Black women specifically, we know that 1 in 8 women in their lifetime will be diagnosed with breast cancer.
Oh, wow.
And right, it is increased. And we also know that African American women at every age are more likely to die from breast cancer as well, compared to other ethnic groups. And there are a lot of factors contributing to this, but we know barriers to access to primary care and also specialty care plays a big role. So that's kind of where SWIO is. in addressing those barriers. And then, yes, we also reach and support women with cervical cancer. And one of our health education webinars, we were able to host an oncologist from the University of Chicago to talk about cervical cancer screening and prevention as well.
Oh, wow. That is, and I have breast cancer that runs in my family. And one of the things that, when our last reunion, which I can't remember when, I think it was 2 years ago, we promised that we would start sharing our health history, right? Because we come together for a reunion and we have a big barbecue and we see cousins we haven't seen, but we don't really talk about the information that we need to spread across the family. And it sounds like if you have breast cancer running in your family or cervical cancer, we need to kind of get the word out to each other to go get screened or know the signs or, so what do you suggest as far as spreading the information?
Right, for sure. I can definitely relate. Like, I come from a very big family. Whenever we have reunions, it is so much fun, lots of great food, laughs, and memories. But we also have tried to make that a time to talk about our family for different conditions. So actually, very recently, I sat down with both my grandmother, my mom, and my sister and just talked about breast cancer, cervical cancer, and other conditions that run in our family. So it was great to learn about that for my own sake. So one thing we do recommend is, yes, to normalize talking about your family history. And the recommendation is for women at age 40 to start getting their mammograms. And maybe I should have started with this. I'm not a healthcare professional, so disclaimer. But these are just general guidelines. So to start getting your mammogram at age 40, and if you know that you have breast cancer in your family history, your doctor most likely will recommend for you to get screened earlier. So just get screened earlier. So I really recommend starting having that conversation with your doctor. Another thing that I've learned is the importance of self-breast exams.
Yes.
It's kind of sometimes I feel like it's kind of taboo. Even women don't like to talk about self-breast exams. And one thing that's really helped me wrap my head around it is that when you're doing these exams, you're not looking for something wrong. You don't want to do it to look for a mass or a lump, but really you're doing it so you can get to know your breast and know what it normally feels like, so that if there is something different, you're able to recognize it. So I think to not be scared to do that and even talk to your doctor about how you should do it and how often, is really important.
Yeah, you have to know your body. You have to know what feels right and when something doesn't feel right, because that could be the difference between life or death, actually. Right. Hey, listen, while we got a little break in the conversation, can you give us the website address and the phone number in case people are interested?
Yes, absolutely. So Sisters Working It Out, the website is just www.sistersworkingitout.org. I don't have the number off the top of my head, but if you search us on Facebook or the website, it's right there at the bottom on the contact. So if you yourself need a mammogram or know someone who needs one, just fill out the little contact form on our website and we'll be able to connect you to a mammogram. We are able to help anyone regardless of your insurance status, regardless of your ability to even get to the clinic. We are here for you. So I think something that we've talked about on our team is that screenings have gone down during this time because of COVID, and people are worried about getting the virus at a healthcare clinic, which is completely understandable. But I think now if you're able to schedule it, to do it, it would be really good to do it.
Awesome. So a little bit about you. How did you get started with this organization?
Yes. So I graduated from the University of Michigan in May of 2020. Go Blue.
Congratulations.
Thank you so much. So if anyone out there from Michigan, go Blue. And so I actually am pursuing medicine. So I was starting to apply for medical school to start this summer. And so I wanted in my gap year to do something where I can impact those around me. I can serve my community. If it could be public health related, that would be a bonus because I've always had an interest in public health. Um, and so once I came home, my mom actually connected me with the CEO, Miss Beulah Brent, amazing woman. And
Yeah.
my mom actually has known the CEO since I was a couple months old. And basically, Miss Brent just needed someone to help with their newsletter. And I had some experience with that, so I helped with that. And once we got on the phone, it was like magic. We've been like inseparable since. And I was just really drawn to the mission and how established SWIO is and how it serves the women in the community, and it's been able to form these long-term relationships with women and help them through their journey. So it was just a perfect fit for me, and I'm really grateful to have the opportunity to be a part of it.
Now, this may be an obvious question, but I just want to make sure for our listeners. Is it just for Black women, or is it women of color, or any women? Like,
right? No, it is not just for Black women. So most of our services and our events, we are focusing South Suburbs, like Madison, Robbins, Hazel Crest, and other like surrounding communities. And we do some events too in like the downtown, like West Chicago area. But we are open to helping anyone and everyone. So I think that our mission is rooted in addressing healthcare disparities, which primarily affect women of color, but absolutely we are there to empower all women.
And what's that website again? Because I got the number.
Yeah, www.sistersworkingitout.org.
And that number is 312-574-3053. That's 312-574-3053. And now, speaking of health disparities, let's talk about the one we're dealing with right now. What's going on with COVID-19, and what are you guys doing to help out with that?
Yeah, absolutely. So I can't believe we're approaching almost a whole year since the pandemic kind of began in the U.S. But we do know that African American people and women and people of color are dying from COVID-19 and also just experiencing more severe disease compared to other ethnic groups. There are a lot of different factors contributing to this, but we recognize as an organization that we should work to help people during this pandemic. So we have been partnered with Cook County Department of Public Health. We got a grant from them to provide, yes, so we're really excited about that, but to provide both PPE and health education to people in the community. So with PPE, I actually have one of our PPE bags right here.
Oh, nice.
So a little spotlight for that. But our PPE bags, they come with masks, gloves, hand sanitizer, and everything. And we've been able to distribute it to essential workers, we've been able to drop it off at public libraries, so anyone who uses the library can have a bag. Also, residents of assisted living facilities. So a lot of groups that are experiencing very high rates of infection and just being affected by COVID. And one thing that we really are proud of our bags is that in each bag, there are 3 cards. So the first card just talks about sisters working it out and all of our services and the importance of mammograms and how to stay connected with us. And then we have 2 cards that are adapted materials from Cook County Department of Public Health. So the first side talks about COVID vaccines, like 5 things you need to know about COVID vaccines. And then the other side talks about what to do when you're sick, what are some symptoms, and how you can get care. Our other card, one side talks about the campaign Spread Facts, Not Flu. So it is flu season too. So if you're able to get your flu shot, I highly recommend that as well. And then finally, last but not least, the probably heard, but mask up. So wear your mask both over your nose and your mouth. So we're really proud to be able to provide that health education just within our PPE bag. And then we've also scheduled these webinars to talk about different topics related to the pandemic.
Oh, how can we check out those webinars?
Yes, so we have been doing 2 a month, and so in January we had one with 2 pharmacists who they talked about COVID-19 vaccines, and we had a great Q&A. And then we had another one talking about cervical cancer awareness, and also COVID vaccines. So it's okay if you missed those, but if you go on our website, sorry, not our website. If you go on our Facebook page, sistersworkingitout.org, and you scroll to the top of the page, it's actually a pinned post, and it has all of our recordings for our previous talks. So.
Oh, and these things are free? Are they free? Or
they're absolutely free. And we post flyers on our website and our social media, Instagram and Facebook. So you'll be able to find it that way. And they're usually about an hour with plenty of time for Q&A. And it's completely free.
Oh, neat. Well, I got a question here. It says, are you partnering with any community organizations to help with the vaccination?
Oh, yes. So we actually have done one event with Walgreens, because one of their pharmacists is on our team, and we know that they are going to be helping with the vaccine rollout. They've already started giving out vaccines, so we're hoping to partner with them more to be able to give out vaccines.
Okay, terrific. So what about some events that are coming up between now and maybe April or May?
Yeah. So like I said before, our health education webinars, we're trying to have 2 a month. So in February, our next one is on February 20th, and we're going to be having Dr. Renee Poole, who is a physician. She specializes in both family medicine and lifestyle medicine, and
Nice.
she'll be talking about her experience taking care of the community during the pandemic. So we're going to be having her. And then on February 27th, from 11 a.m. to 12 p.m., I believe, we are partnered with the University of Chicago, and we will be having a Hpv education session with a member from University of Chicago. So that session is all about cervical cancer awareness and the Hpv vaccine. We know that that vaccine protects you from not only cervical cancer, but a variety of other cancers. So participants, you do have to be 18 years or older. But if you participate in that session, all participants will get a $20 Amazon gift card. So I think that's a win-win. You get to learn more about HPV vaccines, but also like get an Amazon gift card, get something nice for yourself or someone else. So yes.
So what do you think about this whole controversy around Black folks not wanting to take a vaccine shot? Like, what's your personal view? I know I have my own, but
yes. So I think I would just say, first of all, that I understand where the hesitancy is coming from. I know that there is a breast cancer awareness and advocacy organization. Okay, no problem. I was like, wow, the person who just joined us sounds a lot like
I know, right?
So I understand where that hesitancy is coming from. You know, historically, Black people and the healthcare system hasn't been a ethical relationship in the past, and it's a work in progress. However, I think there are differences from the past and what's happening now. I think that now a lot of public health officials and leaders in healthcare recognize that COVID is affecting Black and Brown bodies at a higher rate than other ethnic groups, and that they are trying to make sure that this vaccine is available for us first. So I personally, and this is my personal view, I believe in the vaccines. When it is offered to me, I will be taking it, because I believe in the scientific process and all of the leaders and their credentials, who work to put it together. Um, and also just learning about the research team and who was a part of coming up with the vaccine. There are a lot of Black scientists who were there, and have faith in that vaccine. So I do, and I will be taking my shots. And for those of you who are hesitant or not sure, I just encourage you to come to our health education webinars or go to other talks that other groups host to to get your questions answered so you can make an informed decision. I always say that knowledge is power, so being able to gather all the facts and then make your decision is super important.
Yeah, and I think that whoever's listening out there, you need to get the vaccine, because if you don't get the vaccine, you're leaving yourself vulnerable. You really are. And at least if you get the vaccine, you made one step to protect your health. I mean, if that's any way to look at it. And, if we didn't have vaccines, there are a lot of us that wouldn't even still be here. Like the polio vaccine and smallpox vaccine, and I could go on, but we take those vaccines as children, and no one says anything. It's just normal. So we need to look at this vaccine as just another step in the process of making us healthy, and we need at least 70 or 80% of us to take the vaccine so that we can get herd immunity, because it's almost next to impossible to vaccinate everybody, because there's always going to be people hiding out. They're either stuck at home or they're out in the rural areas or something. So if we can get 70 or 80%, we're good. So that's what I worry about, is that we don't get enough to build a critical mass so that we'll have enough immunity across our communities to keep us safe. That's what I worry about.
Right. Absolutely. I think we're at about like 10% now.
Yeah.
And I know some people are like, oh, I'll just wait. Like once a lot of people get vaccinated, I will, or I won't need to. But I'm just saying, like, we can lead by example, and I think it would be great if we could do it.
Awesome. Well, is there any other things you want to tell us about Sisters Working It Out? Because it sounds like you guys got a lot of stuff going on. So.
Yes. So I guess I want to talk about another thing that is coming up. So I know earlier I talked about one of our services is a community health workers training.
Yes, that's what I want to circle back around to. That sounded really cool.
Yes. So this will be my first time being a part of it in terms of the planning, and also I'll be like attending the classes too, just so I can get even more knowledge. So we are looking for people who are interested in taking the class. The dates are still being finalized, but it most likely will be in April. It'll be a 14-week class, 1 day a week. And really, it's just a great way for you to, at the end of it, you will be a patient navigator. You can be a part of our team if you'd like, or you can use your skills to work in a different organization. But I just open and invite anyone who wants to serve their community, serve women who may face barriers to healthcare, and be that patient navigator.
That's right, because your personal stories matter. Your personal stories matter. And I remember I was having this conversation today with someone about how we don't, Black women and brown women don't trust sometimes the medical community that's in their neighborhood. So I remember my mom always said, always have gas in your car in case you have to go to the hospital, right? And it's funny, but when you think about it, it's actually kind of sad, because that means we all know that sometimes hospitals and healthcare organizations don't treat us in the way that we deserve, and we have to drive across town or way out in the suburbs in order to get to a hospital that actually will treat us with the respect and the dignity that we deserve. So it's really great hearing that you have this patient navigator training program. That's really awesome because a lot of old school folks, they would rather say, hey, I'm all right, I'll just wait to the emergency room, when that's not really the way to go. So how can people apply for this program? Like, what do they need to do?
Right. So once we finalize the class and our dates, we will be posting it on our Facebook page and also our website. And there'll just be a short registration form asking you about your interest in the program and how you foresee the program like fitting in with your vision. So definitely, once it is finalized, everyone who follows us on social media and our website will know about it.
So do you need any previous experience, and what's the age limit?
Right. So I believe you will have to be at least 18.
Okay.
And no previous healthcare experience is needed. It's valuable, but it's definitely not needed. So both you don't need previous healthcare experience or also any medical knowledge, no knowledge about breast cancer, just an open mind and willingness to serve your community at the end of it.
So that might be a neat thing for people like you that are interested in medicine or nursing or biomedicine. And it's also kind of nice for people who are retired or have some time on their hands. That could be a great way to fill up some time during the day. Well, look, it has been terrific talking to you and finding out all of this information. We're going to stay in contact so that we can get some of those sweatshirts.
Yeah.
And maybe we can get some of those PPE packs.
Yeah.
And we can spread the word. And hopefully, fingers crossed, in the spring, maybe we can have a health fair, because we try to be very community oriented here at HSA Southwest. So we've had community health fairs where we have health partners come in and give flu shots and teach people about high blood pressure, and we do physical activity challenges. So it's kind of fun. So hopefully you'll be around and you won't mind coming in, hanging out with us a little bit when the weather gets nice.
Yes, absolutely. I don't know if we have time, but there were just
we got some time.
Okay, great. So kind of circling back to the patient navigation.
Yes.
I just want to give a shout out to SWIO's community health workers, our volunteers, and our survivors. They're the people that make this organization run. And our CEO, of course, Ms. Beulah Brent, who is just a beacon for SWIO and for all of our efforts. I think what's really special about our survivors and also our patient navigators is that they just hop on the opportunity to connect with a woman who maybe just got diagnosed and doesn't have someone to go with them to a doctor's appointment and are really nervous and scared. So they are just more than willing to be like, oh, I'll go to their appointment with them and be there for them, so that, let's say the doctor is talking and it sounds like they're talking like a mile a minute, and being able to write down questions for them, and then after the appointment, checking in with that woman and going over what happened, and then reminding her like, okay, these are some questions at your next visit you can ask, or remember you told me that this side effect was really affecting you, like maybe you can bring that up at your next appointment. So those little interactions are just examples of how SWIO empowers women to take ownership of their health and to make sure that their concerns are taken seriously at doctor's appointments. So I just wanted to shout out all of our SWIO community and staff. And then the other thing I want to talk about was just general news from Cook County Department of Public Health, very briefly. So one, just a reminder, if you want to know information about COVID, to be able to register for the vaccine or even find places to get tested, you can just go to www.cdc.gov Cook County Department of Public Health.org. Or if you don't want to type all of that out, you can just Google search CCDPH. And the whole website is translated in so many different languages. So make sure it's accessible to everyone. So you can just Google search like CCDPH Spanish, or they even have Yoruba, Nigerian. So that's really great. So I didn't notice that. I was like, wow, that's cool. So that's just a great way to stay connected and to register for your vaccine once it is your phase and you're able to.
Yeah, and the word is today that we just got 200 million more doses, so we'll be able to get everybody, hopefully, shots in arms by April. So look, Miss Adeyemi, you have been fabulous. You really touched my heart by shouting out to the survivors and the essential workers and folks on the front line, and your the patient negotiators, and for being advocates. And because I might join that training and get some of my other girlfriends to kind of help out. We're always trying to find ways to give back to the community, and this is a perfect way. And I really want to thank you for coming and sharing everything that you're doing, and stay in touch, because now you're part of the Husky family.
Yes, thank you so much for having me.
Thank you. We will stay connected through the community, and have a great winter. Hopefully we'll see you before the weather breaks, but if not, definitely in the spring we'll have to plan something.
Yes, absolutely. I hope you stay safe, healthy. Everyone who's watching, also stay healthy, mask up, get your vaccine when it's available, and yeah, thank you so much.
All right, have a good night.
All right, good night.
Bye, everybody.
Bye.